a member of the CCDP Steering Committee, and he is also our coordinator at the center. And Dr. Stephanie Mathis, who's also online, is a faculty in our center and assisting with the evaluation for the Drug-Free Communities grant that you all just received. So our group, our center sort of began in 2012 with engagement from our community. Folks in the community wanted to know what ETSU was doing around the problem of opioid use disorder and the overwhelming number of overdoses in Central Appalachia. And while a number of faculty members were working on it, we were not working collectively. So we began talking to community partners, writing grants, and what started with a group of about 6 people now is over 300 people on our email distribution list, and we still meet each and every month. And you're welcome to join us for those meetings at any time. We'll talk to you at the end about what that would look like. So during this time, we were envisioning what would a formal center look like. We were doing great partnership with our community, but we were curious about different centers. We applied for a CDC center grant. We were not awarded that grant. And then we thought, well, heck, we can do it without money. We're already doing this work. And so this was the initial vision, that we would have a center for prescription drug abuse prevention and treatment. And that it would have a variety of cores. We would have, ultimately, we wanted to provide clinical care if there were needs in the community, education and outreach, research and evaluation. And so in 2016, the Tennessee Board of Regents awarded us this center, and it was the Center for Prescription Drug Abuse Prevention and Treatment. And all of us are really happy that that is no longer the name, because typing it, saying it has been really complicated. It's a long name. And it is about prescription substance misuse. We try not to use the word abuse as much. There's a sort of a negative connotation to that. And we all know that this opioid epidemic has morphed away in many respects from prescription drug misuse. But that was 2016. These are our mission and values, which also need to be updated in that we see that we're using the word abuse, and we'd like to replace that with misuse. Otherwise, I would say that our vision, mission, and our core values are accurate, as you see in this slide. Whoopie. There we go. So we've been busy since we started interacting with our community members. This list of products is by no means just the 4 or 5 paid staff people that we've had in and out over the years. This involves all of our community partners and faculty from both ETSU and other universities. So you can see that we've been very busy putting forward grant proposals for research questions we have, serving on national boards and task forces, state and national task forces, putting forward peer-reviewed literature, and thankfully in January of 2020 we got a new name that encompasses all of the work that we're doing and the transition away from prescription drug misuse and the addition of a lot of substances, including methamphetamine, that are being used simultaneously with opioids. So this is a busy slide, but I always have to say it because this is sort of the framework, the foundation from which we work. We understand that substance use disorder is along a continuum, and there are evidence-based strategies all along the continuum. You get the bigger bang for your buck on the left-hand side of the screen if you prevent people from misusing in the first place, or catch them early, say in a primary care visit or something when they're just beginning to misuse. It's much easier to turn them back towards a better quality of life and healthy living than it is once folks have really triggered substance use disorder, and then often end up needing treatment. And unfortunately, only about 1 out of 10 people actually currently get the treatment that they need. So we know that you can't just put pressure or intervention on one piece of this spectrum. It's important that our region think through the whole continuum. Again, public health, I am employed by the College of Public Health. Many of us are public health trainees. We're trained in public health, and the idea is that catching folks upstream, like the work that you're doing with young people and in your community, is much better than looking at the problems that occur downstream of these public health problems. We can, we're learning a lot about public health also with the COVID-19 situation that we're in, and the better, the things that we're all doing right now are preventing the spread, community spread of the disease. So public health is very much focused on that front end prevention piece. So going back to the 4 cores that we work with, I'm not going to talk about all of the things that we've been working on with all of you in the community, but that outreach and education core is what brings us to work with Carter County Drug Prevention. We partner with multiple coalitions. We support grant writing, implementation of evidence-based practice. We serve on boards. And so I was going to see if I could take you to this link. Okay. All right. I'm just going to show you our website just so you get one quick glimpse of it. Let's see here. Stop share. I want to stop the sharing. Okay. And let's see. Can you see something that says annual report on your screen? Someone give me a thumbs up. I can only see one person's face.
Yes, we can see it.
Perfect, perfect. Thank you. All right. So here's our website. Here's the home page, and it has different things that we've done. The cool thing is affiliated projects, and we get to talk about Carter County drug prevention and the things that you all do. And we link to your website, and we talk about press that we've shared with you. We also work with the workplace prevention, Count It, Lock It, Drop It, and a variety of trainings. So this is our website. You can do ETSU Addiction Science Center. And you can see other things that we've done are in our news and events. Look, well, we became the Addiction Science Center, yay. But just a variety of interactions, outreach, and education to our community. So all of that is available for you. And I'm also going to show you what is also helpful so I don't have to toggle back. I have a link at the end, but our annual report here, there it is. Can you see that as well? Annual report, big. Okay, perfect. And so if you're curious about, like, what are these guys studying? What are guys and gals? What are these people studying? This annual report is available. You can download it. It's all of the names of the folks that work with us, our activities, some photos, research that we're working on now. Our active research is up here in the left-hand corner. Task force that we've served on at the national level, Nick Hagaman and Dr. Robert Pack. And then also the publications. So if you want to know anything about healthcare provider communication, how doctors are talking to folks about prescription drugs, how pharmacists are engaging in this, medication safety and disposal, a variety of things. This is all available to you on our website. All right, so I'm going to toggle back and finish this very quick presentation here. Can you now see the screen? Yes, thank you. I'm appreciating that thumbs up from, I can't remember, the person who works in juvenile court. Thank you so much for your thumbs up. I'm really appreciating that. That's helpful. I see your face at the top of my screen here. And so let's see. There are some evidence-based programs, some triple P parenting programs. I wanted to be sure and show a picture of Carter County Drug Prevention and our friends over there. And so our separate core, that was outreach and education, and again, clinical care. So we partnered with Ballard Health System to open up a methadone treatment program because there was not one in our region. It was very controversial. We had a lot of signs, a lot of confusion, a lot of fear. It took us 2 years to open this, but what I will say is methadone is a very evidence-based strategy at engaging people in treatment. It is not for everyone. It is very good at helping folks who may have injection drug use, long history of substance use, and who have tried other things. These daily dosings can be very helpful. There's less chance for diversion because they're not sent a prescription that they take out with the door with them. And so for many people, methadone is very effective and has been around for years. And anytime you want some research or evidence about that, I can send you all the pages you could possibly want to read about that. But we were respectful that people were worried about crime, the potential for crime. They were fearful in their community. And I think that there's plenty of news now out that we've been good neighbors and that there has not been any incidents. out there other than folks getting good recovery. So happy to answer any questions about that. Again, we're also offering buprenorphine out there for folks who are grant funded, so it's free of charge. And it's a little different than some of the other programs that we've had in our region. And I think that it's taking care of diversion a little bit maybe better with more evidence-based strategies than we've seen in our recent history. And then last, we've talked about outreach and education. We've talked about clinical care, our research core. And again, there's publications that I showed you. We've had over 30 publications, peer-reviewed publications, and sometimes work that we do in the community ends up evolving into a research study. And the one is a little blurry at the bottom of the screen, but this is a summary of some research Dr. Mathis is doing right now. We worked with workplaces who said, we need your help. We need to do something in our workplaces. And so we've worked since 2015 to offer evidence-based strategies to the workplace, multiple presentations and one-on-one visits. And we have noticed that we haven't had a company yet that fully implemented to fidelity an evidence-based program in their workplace. And we're curious about that. So we know that there's a problem and that there's great interest. So what are the barriers and facilitators to implementing effective, comprehensive drug-free workplace programs and EAPs, et cetera, in workplaces? So Dr. Mathis is going to be studying that. And so we'll have some more information on that. So that's just one example of how community questions can turn into research in our center. And so with that, I will stop. These are just folks that have helped us along the way, our partners. This is by no means a comprehensive list, but these are some partners and some funding that have helped us along the way. I will let Chris talk to you a little bit. Chris, if you just want to let them know how, if they want to be engaged with our center, what that looks like, since you're often the primary first person that they talk to when they call or email our center.
Absolutely. Can everyone hear me?
Yep, we can hear you.
Okay, great. Just want to let everybody know that we do a monthly meeting. We call it the Addiction Science Center Working Group meeting, and that's open to anyone in the community. It's going to look a little different with things are happening at the moment. We will probably move those online in a Zoom format similar to this. But we do that on the second Tuesday of each month, starting at 4 o'clock in the evening and lasting until roughly 5:30. It's a place where everyone is invited to come in and kind of share their story, who they are, why they want to engage, and it's also about networking. A lot of connections are made in that meeting that otherwise may not have been, and it's great for anyone to come to and learn more and make those connections. And if you're interested in coming to that, I can send you a invite. You see my information on the screen.
Oh, sorry, I just took it off. Sorry.
It's lewiscl1@etsu.edu, or you can give me a call at 439-5508.
All right, thanks, Chris. And Dr. Mathis, do you want to just do a brief introduction and maybe just a couple sentences about what you're doing with Carter County Drug Prevention? She may have had to take a call or step away from the desk, but she is working with Dolly and Jillian and others to do a formal evaluation of the implementation efforts funded by the Drug Free Communities Grant. All right, I'll pass it back to you. I don't think that there are any questions. That's why I stopped share. I didn't mean to do that to you, Chris, but I was checking the chat box to see if there are any questions, and I don't see any. So we'll just move right along with the agenda.
Sorry, it took me a minute there. Thank you, Angela, for sharing. Anybody have questions for them that they didn't post? Okay. Well, feel free to use that chat box if you think of something, or if you would like to leave your email for Chris to be added to their working group list, feel free to do that in the chat box as well. Just a few things that I had to share. It has been interesting, as I'm sure it has been for all of you, trying to navigate community work from home and in a virtual setting. So there are a few things that we have been able to, we feel like, successfully implement virtually. So I wanted to share just a couple of those things. We're partnering with MAD, which is Mothers Against Drunk Driving, to do a Power of Parent virtual training. So this is a training that MAD actually does, that they have offered to do for us. So if you have parents that you think would benefit from just a 30-minute or so kind of, why is it important that I talk to my kids about using drugs or alcohol or tobacco? We will have that. It'll be a Zoom training. They are struggling to send the Zoom link, so they've asked for emails for people that want to participate. Hopefully I'll be able to get a link, but if you want to participate, for sure let me know and I will send your email along to them. We also are kind of navigating some of the things that we normally would be doing or would have scheduled. And a couple of those things that we feel good about doing virtually are the Safe at Home program by Safe Sitter. So this is a modified version of Safe Sitter that really focuses more on making sure kids are safe while they're staying home alone, than the sitter portion, which talks about taking care of other kids. I feel like this is a very important time for kids to have those skills and for parents to make sure that their kids are being safe at home, if they're working or whatever they may be doing. There's a little workbook that goes with that, and so we mail that to them, and then do the training virtually. So if you all would share that with anybody that you think has a kid who could benefit from that Safe at Home training, we would appreciate that. We've gotten a lot of contacts lately from people asking about smoking cessation. There are some pretty good articles out there about the ways that tobacco and electronic nicotine delivery systems sort of exacerbate the coronavirus in a lot of ways. And so we've gotten quite a few calls about that, and emails, and contacts through the website. And so I'm going to attempt a Freedom from Smoking virtual class. Again, it will be new territory for us. But if you have people that you think are interested in cessation, please send them my way as well. It's not something that I feel good about just posting publicly. I would rather it kind of be a closed group, because it does work best when people are a little bit more willing to share and kind of engage with each other. So I anticipate starting that in the next week or so. So if there's anybody you know that's interested in cessation right now, it's a really good time to kind of open that conversation and say, there's some research out here about this, and so why don't you look at cessation? So just let me know. Please send me contacts for that. I wanted to share some resources with you, and again, you all should have all of these in your email. I'm thankful to Crystal and Jill and Renee with CHIPS and everybody that's been sending these resources out. And so a lot of these I have stolen from you guys because they are really good things. But I just wanted to bring your attention to a couple. This first one that I put on here, and Crystal, I might have you, if you don't care, just share a little bit more about this. But this is a survey that really asks organizations in our community how they're doing and what's going on and what they need, and they're working to meet those needs. Crystal, anything you want to add about that one?
Just that it really helps. It helps. Ballad is very involved with their accountable care community as well. It helps them know where to put their money. So you filling it out kind of draws attention. The only Carter County groups that we actually have involved in the accountable care are United Way and Carter County Drug Prevention. And neither of us really actually get to go to the meetings because we're pretty boots on the ground in Carter County. And he understands that, but Corey Paulson really needs us to help do this if we can, in every agency, and just let us know what you're doing. It also is going to work when we do funds for our regional COVID-19 campaign that we have going, a fundraising campaign. All that money is going to go out to agencies that are responding. So if they've shut down, they're not likely to get money to get back on their feet. If they've been doing things like Carter County Drug Prevention, Red Legacy have both been doing activities, feeding people, doing various things, changing some things to virtual. So those are the people that we will be funding with their United Way funds as well. So it never hurts to hit that accountable care thing and let them know and include that you did that when you apply for these regional funds.
Thank you, Crystal. So can you all see this website that I just pulled up? Yeah, okay. So this is the Strong ACC website. You can learn a little bit more about what they do and kind of what's going on there. It's pretty cool because it's just a bunch of organizations coming together and saying, what do you do and what do we do and how can we work together? So this survey is just another kind of piece of that. Just their way to check on your organization and see how you're doing and what they can do to help. The second thing that I have on here is Summit Counseling is doing reduced fee. Oh, sorry. I don't know what happened. Okay. Reduced fee counseling. This is pretty cool because they have therapists on board to do counseling with anybody that feels impacted in any way by this corona kind of life we're living. And so the most you will pay for counseling is $30. That's the top amount that you'll pay. And realistically, they kind of ask you, what can you afford? And that's what you pay, with the top being $30. So if you know anybody that's kind of working front lines in this, or just feeling whatever we all may be feeling because of this shift in our worlds, that's a great resource for some reduced cost counseling. Some of these other things are just some resources that I found valuable that I hope that you all will find valuable as well. Jill, I think, sent these out. This summit link is really awesome, and they've done a great job of kind of compiling resources, particularly for our region, and Bristol's Promise has as well. One thing I just wanted to mention, if there are mamas that you know that you feel like are needing some support, Cherished Mom is doing virtual support groups specifically for moms. If there are folks in recovery that you feel like are needing some more support, Red Legacy is still going strong. I'll let Sam kind of mention that here in a second. And we still have AA and NA meeting in the office right now, but there are also some online groups as well. So I put a couple here. Again, I think these were from Jill, but just know that there are virtual options out there. I think it's a really tricky time for a lot of folks in recovery. And so just making sure we're supporting everyone and keeping them sober is a priority. And then the last link is just a suicide prevention link. TSPN does amazing work. And if you need connections to Molly Colley or what TSPN does, please let me know. And I would love to connect you with her. Sam, do you want to mention Red Legacy and kind of what y'all are doing right now?
Yeah, can you guys hear me now?
Yes.
Okay, we my board of directors we all decided on the 18th that we would go to virtual groups. It took us about a week, but we're up and running. So we are having groups still on Mondays, Tuesdays, Wednesdays, Thursdays, and 2 of them on Friday. We also have continued our partnership with Strongwell. All of our women that wanted to be included in that have all done their intake. Strongwell is also holding groups on Mondays and Fridays And what I'll do, Jillian, I have all of this, and I'll send it to you, and you guys can send it, you can send it out to everybody on the conference call today. We also have resources like food. So if you know anybody that needs any type of food, please call me, text me, and we will get it to them. We are running daily transportation for our Over Mountain recovery clients daily. All of our clients that were going to AA at Central, we know that that's shut down right now. And we're also transporting one of our clients to work as well, too. So if anybody needs transportation, we are willing to transport them. It is a requirement that they wear gloves. They wear a mask. Each one of them has a new mask every day. Thankfully, from Over Mountain gave us those. And we lost all the vehicle in between drop-offs and pickups and all the things. So we have two Red Legacy Facebook pages. If you will look on either one of those Facebook pages, I usually put the meeting ID on there and the password in the enrolled clients only. Just to keep, we like to keep our groups kind of private, just so everybody, like Jillian said previously, will share and things. But on Fridays, they're all open. So I will share those, and if I'll send out the resources that I have in our meeting list to Jillian, she can send that out, but anybody's welcome. I have had a couple of clients decline doing virtual groups, and I've actually had a counselor decline doing virtual groups. They just said it wasn't their thing, they felt bad about it, but so we're kind of running a little low on people doing groups. So if any of you guys would like to do a group to talk about any of your resources that you have for our clients, usually there's about 2 or 3, maybe 4 in our online groups at this time. Just message me or email me and we'll set you up a time to do it. I think that's all I have.
Thank you.
Jillian, I think there were some questions about Safe Sitter. The 2 questions were, do they have to be Carter County residents, and is there a limit on the number who can attend the virtual training?
No to either one of those. I don't care where they're from. And our Zoom account, I guess, has a limit of 100 people, so we can't do more than 100 at a time. But I'm happy to schedule trainings whenever. It takes about, I guess, about an hour and a half max, depending on how many questions they have to do those. Ashley can do them, Joss can do them, I can do them, Sam can actually do them now. So even if we're doing one at a time that's not convenient, I think we're all pretty happy to schedule one with people, whatever time works and whatever number of people wants to do it at the same time, if that answers your question. Okay, I was gonna ask Shannon or Kelly, or maybe both, to give a little update on our mentoring program and how that's going virtually, if one of y'all will hop on and answer that.
Wow, what times, huh? Can you hear me?
Yep.
Yeah. All right, cool. What we've had to do, we've had to suspend the program for right now, of course, to the government guidelines and local officials. But what we've done, we've created a virtual packet. We've created an online video, and we also created a online PDF, so that way we can still train people to be mentors, which I think was a wonderful idea. We all got together and we done that. And the National Recreation Park Association absolutely loved the idea. We kind of set the bar for that one. And haven't got any feedback just yet from anyone, but I'm looking forward to getting some people. It's out there on Facebook and whatever means that we have, more to mouth and stuff. So if you guys could help us out, we're still rolling, even though we're not in the office. We're still rolling with this program. And plus, we're going to get a bit of an extension, I believe, Jillian. Maybe they was talking about we might be getting a little extension, a break because we're supposed to have so many mentors in September, but I think they're going to allow us to. They're going to give us some leeway on that one. It's not official yet, but it's coming, we think. But other than that, we're still rolling. We're trying to make a difference and still make positive relationships.
Thank you, Shannon. So one thing I'll add to that is if you were interested in being a mentor and haven't been able to make it to the training, or if you're just interested in what in the world we've got going on, Shannon can send you this training virtually. It takes about an hour and a half, I guess. You get to listen to my voice for an hour and a half teaching you all about mentoring. So it's a fun training. If it's something that you would like to do, send Shannon a message, or leave a comment in the chat box and we can get it to you that way. Anything else, Kel?
Yeah, I'll add one more thing while we're kind of on this lull. One of the upsides to this is that we do have time right now, that we're working on some things that we're getting a little ahead on, which is great. One of those things is we now have our skateboard ramps that we had ordered for this program as a way of both serving the mentors and the mentees, as well as being able to take these skateboard ramps to different parks and areas in Elizabethton where we can hopefully positively impact kids who, like to skateboard, don't have a place to do it. Our hopes is to even be able to talk to them about this mentorship program while they're out kind of having some fun with that, and hopefully be able to bring in more kids that way as well. We've also just gotten the last component to allow us to do our esports room at the recreation center. And so this is going to be a room that is dedicated to the kids whose interest is gaming. And there's nothing like either of those components here in Elizabethton at the time. So we're really excited to be able to give our kids here some safe spaces to hang out after school and on weekends, where maybe they're not all sports minded, maybe they don't currently have something to do and they're interested in this, and maybe they can't make it to Johnson City to the skate park, or they don't have internet at home to be able to play video games and things like that. So we're super excited to be able to roll those out as soon as we can have face-to-face contact again.
Thanks, Kel. We will shift over to Jocelyn for a Youth Coalition update.
So we have a webinar training on April 26th at 3 o'clock, which is the Beyond Engagement. And so that's coming up. So I think you have to register for that. Is that right? Or is it just show?
We just have a Zoom link we can send you.
Okay, perfect. So I think we sent out that Zoom link a couple days ago. So check your emails for that, and let us know if you need us to send that again or anything. And as of right now, the Tennessee Strong Conference and the TTI conferences are still on. So that's exciting. We're hoping they stay on. And so if you have kiddos that are interested in going to that, let us know so we can get them on the list and get them signed up.
I got an update about TN Strong today. Can you guys hear me?
Yep.
Yes.
Okay. I just got an email that they canceled TN Strong as of today.
Just
I know.
kidding.
Just kidding.
I know. It says that it's been canceled. They're going to create some documents to share with the ambassadors. They're discussing a new virtual conference and Grand Division trainings. And then the ambassadors that have been tasked to complete presentations are still to do so. They're still going to use those presentations. But that's all that information I've got today. And Michelle just sent that up to us today. I'm sorry.
Sad times. So I guess we'll look for a virtual option for that hopefully soon. just one more thing about the marketing training. I'm not sure everybody received that link, so if you want that link, let me know. Beyond Engagement is a marketing company who's gonna really just talk to us about framing messages and some just some different marketing strategies for social media. And our Youth Coalition does a lot of work on social media and kind of getting teens to make better choices. And so she's going to hopefully just walk through some of that with us, with what kind of messaging will be most impactful for the people that we serve. So y'all are welcome to do that. It's on a Sunday at 3. Yeah, so let me know if you want to join us. So I'll kind of turn it over to you all now. What updates do you all have? I would love to know how we can support you right now, how we can partner or encourage you, or anything that we can do for your organization. So y'all let us know.
I'll start if that's okay, Jillian. So number one, I don't think anyone from the Census Bureau is on here, but today is the last day to complete your census. And then also, if anyone has any resources, links, webinars that you would like me to include, I'm trying not to overload with continuous emails, but trying to compile those and send those out. If you are getting those, please feel free to share those. But if you have any that you would like me to include, please let me know, or just email them to me. And then also, typically our regional council hosts trainings throughout the year, and obviously we're not able to do those, but I'm looking for opportunities that we can provide through a webinar or WebEx. So if you would like me to host something, please reach out to me and we'll see if it can work out. So that's all I have.
Jill, can you remind me what your council is and what you do? I know I should remember this from introductions, but my memory's terrible.
Oh, no, that's fine. I'm with Tennessee Commission on Children and Youth. So we host usually any kind of educational opportunities. We aren't direct line working with families or children, but we work with those that work with families and children and try to provide educational opportunities for them.
Okay.
Does that make sense?
Mm-hmm.
So Jill, something cool that I will kind of share with you. Jen Croft okayed us using the Building Strong Brains presentations that she gave us, like as trainers, as part of our virtual mentor program training. So I love that because all of our mentors have been getting ACEs training at that first meeting, but we're actually able virtually to give them the presentation from Jen. So that was really exciting for us.
Wonderful, that's great.
Anybody else have updates?
I just like to say that one of the things that Childcare Resources and Referrals been really working on these past couple of weeks is just finding out which childcare centers are still in operation, what their needs are. One of the things that we're finding is that a lot of the centers are having to close because they can't find food and they can't find cleaning supplies. So if any of you have any access to anything like that that you could send to me so I can share that with the centers that are still open, that would be great. And we're also comprising a list of how many slots are open within the region. So if there's anybody that's needing childcare, they can contact any one of the CCR&R coaches and we can link them with a list of centers that are still open and how many slots they have. We're also comprising a list of the centers who have openings for teachers because a lot of the teachers have been laid off and we're trying to connect those teachers with jobs that are open. So that's pretty much what we're doing right now.
Thanks, Mary.
This is Lexi with Nurse Family Partnership. And I don't know if you guys all know about our organization, but Julie Shoemaker used to be in this group. And just to remind you that we are taking referrals for any first-time mothers who are in the 8 counties of East Tennessee. So they need to be first-time moms and 28 weeks pregnant or less, and meet some poverty guidelines. So if there's any referrals out there, please let me know, or visit the Nurse Family Partnership website and you can get a hold of us there.
Thank you. Anybody else have anything?
I have some, they're not all mine, but River's Edge is still doing feeding from 5:30 to 7 every day in conjunction with their One World Everybody Eats Cafe, the Over Mountain with Miss Sarah. They have a grocery list of needs, so if anybody can contribute, if you can just shoot me an email at United Way, or I can pass that along to you. Miss Vicky with is doing masks. They need them desperately in Carter County nursing homes. She has all of the things, so she will send you the pattern and the material. She'll make a pickup there, I think at their offices, and they are desperate for that. Then again, the regional fund, if you guys can send me things that you are doing, Carter County is specific, so that we can consider some reimbursement to you guys for the regional fund. I have 211 and lots of other places that are looking for homeless resources, because there really is nobody kind of serving, and those that aren't taking new people and are kind of full up. We launched a new website, www.ecj.org. And we're going to be launching the first unfinished portion of our Treasures and Tales project, which is the story project that'll go up on our website, because whether it's done or not, this is the time that it needs to be launched. And we have a new volunteer website. So if you're looking for volunteers to do stuff even virtually, and I'll send that link to you. And then do not forget that locally, Citizens and Carter County Bank are going to be those small business association things to get this payroll loan that is open for 501c3s. And that gives you, I think it's 8 weeks, 2 months of your payroll and utilities that are in this loan. And then as long as you don't overspend or spend it on something that you shouldn't have, you're going to get that money forgiven.
Hey, Jillian, it's Nicole. I have something to say.
Okay.
So Elizabethton City Schools is still providing meals, and it kind of changed this past week. So Monday, they'll be giving breakfast, and it can be picked up from 9 to 9:30, and lunch from 12 to 12:45. And then Tuesdays, they're going to start doing Tuesday through Friday, lunch and breakfast for the following day can be picked up between 11:30 and 12:30. And that's at East Side, West Side, and Harold McCormick. And you just have to be under the age of 18 or under.
And I'll add to that. Thank you, Nicole. County schools are feeding as well. And I just kind of wanted to throw out there that they are going to a modified schedule. So instead of serving 5 days a week, they're only going to serve on Mondays and Wednesdays. And on those days, folks will get food for, like on Monday, they'll get food for Monday, Tuesday, Wednesday. On Wednesday, they'll get food for Wednesday, Thursday, Friday. I have some real concerns with that, because I worry about all the food getting eaten right in that first day, and them not being able to access it for the other days. So Ashley and I have been working really closely with Brandon Young, who's amazing, to give him some snack bags to send home with kids. But something else that the county just did is also discontinue feeding sites outside of the 5 main school locations. So in the past, Brandon and others have been able to kind of go into neighborhoods and remotely feed people, and they're not going to be allowed to do that anymore either. So I don't even know what that ask looks like at this moment. If there are things that you have in your pantry or that you feel like you could share or purchase for some more, just some more snack bags, please let Ashley or I know, and we'll kind of continue trying to keep getting those out there. We had a sweet friend in Hampton with coronavirus that I'll just say thanks to those of you who have been supporting her and kind of helping us take care of her a little bit. So we continue to meet needs as we can. And I know all of you all are kind of doing that as well. But I'm grateful for the city for their feeding continuing, and the county as well. Just kind of be aware that we may have folks around us that aren't getting the same food as they were necessarily, because the county has shifted to the 2 days instead of 5, and not feeding in neighborhoods anymore. Just to kind of make everybody aware of that. So thank you, Nicole. Anybody else have an update?
Yeah, I was just going to say, with the health department, we're operating under like an emergency operations plan. So some of our services are different. A lot of our services now are car-side services. So like people need WIC services, just can always call the health department, and most of that will still be happening. It's just going to happen at someone's car or over the phone if possible. We still have the Northeast Region Coronavirus Public Information Line. It's a 423-979-4689. And that is just any and all coronavirus questions and concerns. You can call that number. If someone feels like they need to be tested for coronavirus, they call that number. A nurse will screen them, and they're going to send them to a location to get tested if they need it. And then starting Friday at the Carter County location, we will have a pod set up where we're going to have people. It's like a drive-through testing site. They still have to call that number that I just gave you to get approved to get tested. They're not supposed to just drive through and show up, so they can't get tested. I'm just driving through, and they're going to have members of the National Guard there. And those are just medical staff from the National Guard that are just medically trained, like APNs and nurses, help administer those tests. But yeah, please call that number. It's 8 to 6 every Monday through Friday, but there's also after hours numbers and weekend numbers. Somebody's always answering. Yeah.
Can you repeat that number one more time, Emily?
Yes. It's 423-979-4689.
Thank you.
Yeah, you're welcome.
All right. I was going to share that for the past month, I've been in contact with the breastfeeding peer counselor over at the health department, Gracia Cash, on revamping Mom and Baby Cafe. And so we were originally planning on having a mom and baby get-together group starting soon, different than Cherished Moms, more informal and not a 10-week limit thing, but more of a kind of come and go as you please thing. But since we are not meeting, we decided to do in person. We decided to shift it over into a virtual option. And so she and I have worked together. We created a Facebook moms group specific for Carter County area. And we are actually having a Zoom meeting tonight with, like, we have about 50 moms in our group, and we're going to have a Zoom meeting tonight for just moms to get together on there and chat together. So we're going to do that 2 times a week to start, to see how what the response is like and see where that goes from there. I am also working on the Drug-Free Communities Core Measures report as part of our progress report efforts. So working on that, and getting some signs from TWRA about voting and drinking. But yeah, I say of all the things that I'm working on, I'm really excited about the virtual moms group.
Can you give me any information if I have moms who would like to join in Carter County?
Yeah, absolutely. The catch is for the Facebook group, obviously they would have to be on Facebook.
Okay.
but of course, that's not, if they want to do the Zoom meeting, I can shoot you an email with that link if they want to just join on there. But if they want to be a part of the Facebook group, I can send you that too. Do you want me to give you, hey, let me write down, I'm going to write in the chat box my email address, and that'd be the easiest way for me to send you everything.
Thank you.
Yeah, of course.
And Dolly, if you want to send it to me, I can send it out to everybody too.
Okay, great. Thank you.
Will you, Dolly, just for anybody who hasn't met you, will you share just a little bit about who you are and what you're doing here now?
Oh yeah. Hi everybody. So I'm Dolly. I was recently hired back in mid-February as a project coordinator for Carter County Drug Prevention. So I am brought on underneath the DFC grant, the Drug Free Community Grant. So my role is to oversee the requirements for that grant, which includes creating a community needs assessment, doing some collaboration work and within the community, and really continuing doing all the great work that you all have already been doing at Carter County Drug Prevention, but very specific to that DFC grant as well. So yeah. I'm me. I don't know what else.
Perfect. Thank you, Dolly.
Yeah.
Anybody else have anything? Okay, well, I appreciate all of you for being here. We will do this again next month. If you have questions about anything we've talked about, please let me know. Feel free to shoot me an email. Or if you have resources you would like to share with the whole group, let me know as well. One more thing I'll just add quickly. Joss has started us a monthly newsletter that should be coming out. I've had some people saying that it's going to spam, and we're working on that, on figuring out how to make our email address sort of verified so that doesn't happen. But in the meantime, please check your spam boxes. She's doing a great job with really kind of capturing what we're doing and kind of spotlighting some of the people we partner with. So check your spam boxes if you didn't get our newsletter this week, and watch for it again the first week of May. So thanks everybody.
I'm so sorry, like 10 more seconds. I completely forgot to mention National Prevention Week is I'm National Prevention Week with the Youth Coalition with Joss. So totally forgot to mention that. So I am working with the Youth Coalition to come up with some ideas for National Prevention Week, which is May 10th through 16th. The theme is Prevention Happens Here. If any of y'all have any ideas on some things or events that we should do during that week, please email them to me. Thanks.
All right. Anybody else have anything? Okay. Thanks everybody for being here. Stay healthy.
Bye.
Bye.
Bye, everyone.
Bye.